Paracetamol tablets, as we all know, look so harmless because of its white color, its small size, and over familiarity with everyone because everyone knows paracetamol tablet, be it a child, be it an adult, be it the elderly person, everyone knows paracetamol tablets. But as common and as familiar it is to every one of us, when taken beyond its safe limits, it becomes one of the deadliest poison ever known in medicine. So it is wrong for you to commonize any medication. It is wrong for you to commonize any tablet, be it vitamin C, be it folic acid, because it's so tiny. Don't commonize it because every one of these medication has its own function and its own complications associated with it when you exceed the safe limit. And the dangers or the complications associated with it doesn't come from the tablet itself. Yes, the danger doesn't come from the tablet. Rather, it comes from what the body does with it. So the danger is not from the tablet. It is what your body do with it. It is how your body responds to it. That is where the danger comes from. So in this video, we are going to be discussing the dangers or the complications associated with the abuse or overdose of paracetamol tablets. I encourage you to visit my channel and watch the previous video on 5 things you don't know about paracetamol tablets, and second video on reasons why we have so many cases of liver disease, liver damage, liver injury in our society among the younger generation these days. And I can tell you one of the reasons is because of the abuse of tablet paracetamol. So in our medical world, in our emergency department, you see a whole lot of young people with liver disease, liver damage, liver injury. That is because of the abuse of tablet paracetamol. So I encourage you to visit my channel to watch this video because this is a continuation of that video. All right, so endeavor to subscribe to my channel if today is your first day seeing this about this video, or if today is your first day coming in contact with my channel, please endeavor to subscribe. Also share this video to enlighten others. You might not need it, but people around you might need this information. So as a good citizen, I encourage you, share this video to enlighten others. So without further delay, let's dive in to the complications or dangers associated with the overdose of tablet paracetamol. And number one of it is acute liver failure or hepatotoxicity. Acute liver failure, hepatotoxicity, that's a medical name for it. This happens when you have been abusing paracetamol tablet for a very long time. It becomes toxic in your system that eats up your body. Remember in my previous video I said that when you keep on abusing tablet paracetamol, it is no longer medication, it turns to poison and toxins in your body that eat up your cells. So when you keep on abusing the tablet paracetamol, it becomes toxic in your system, and that brings about a condition known as hepatotoxicity or acute liver failure. So when there is acute liver failure, there will be a massive liver cell destruction and buildup of toxic substance, and most times rapid organ shutdown. That is in the critical stage. Number two complication of paracetamol overdose is jaundice. Yes, yellowish discoloration of your skin, your eyes, and most times your urine and your feces, because as the liver begins to fail, bilirubin begins to build up in your body. This leads to the yellowish discoloration of your skin, your eyes, your urine, and sometimes your poo. This is a sign that your liver is struggling for survival or about collapsing. So it's a dangerous sign and the reason why you should not abuse paracetamol tablet. The third complication of paracetamol overdose is severe abdominal pain and vomiting. This is because overdosage of paracetamol will irritate your stomach and damage your liver, leading to persistent vomiting, nausea, and loss of appetite most times. So it's essential you don't abuse paracetamol. As common as you think, it is not common, okay? Paracetamol is not common. Stop commonizing it because its impact is not common. So to stay healthy, don't abuse tablets, paracetamol. The fourth complication of paracetamol overdosage is called coagulopathy. This is a problem with your clotting factor. There will be slow blood clotting. Okay, the clotting time will be affected, and when your clotting time is affected, one can be bleeding internally, little injuries, you'll be bleeding profusely, and it will take a longer time. That is why most times you see some person bleeding excessively, and it takes a longer time for the bleeding to be arrested because they have poor clotting factor. That is coagulopathy. So ensure you don't abuse paracetamol, because when you keep abusing it will be building up in your system. It turn to toxic, it turn to poison, affecting every part of your body. And when this happen, your clotting factor will be affected, it will be impaired, and that will lead to one bleeding internally, or when you have little injuries or little break, the person will be bleeding excessively. So ensure you don't abuse tablets, paracetamol. The fifth complication is hepatic encephalopathy. This is because the buildup of toxins in your liver has affected the liver to the point that your brain cells are also affected. And when your brain cells are affected, there will be disorientation, there will be slow speech, there will be restlessness, there will be confusion, and sometimes coma. Okay, the person become comatose as a result of that, because the brain cells are affected and the person will be in a state of confusion or disorientation. So the number 6 complication associated with paracetamol overdose is multi-organ failure. Multi-organ failure in the sense that every organs of your body are interrelated, they function together. So when one organ is affected, it affects every other ones. Gradually every other organs will be affected, and not only the liver. And that is why from liver disease or liver injury, it will come to kidney or renal failure, kidney failure, because all the organs are interwoven. Okay, the organs are working together. So as a result, once one organ is affected, it will also affect other organs. So it will now lead to multi-organ failure. And once there is multi-organ failure, there's a problem. Okay, there will be challenges in your body system. If liver failure continues unchecked, it begins to affect other organs of the body, leading to kidney failure, heart problem, respiratory failure, and brain swelling. Once you get to this stage, it is a fatal case that needs urgent intervention and God's intervention for the person to survive. So you must not abuse any medication, not only paracetamol. Any medication should not abuse it, because every one of them has their dangerous side effects. Number 7 complication is metabolic acidosis. Your entire body becomes so acidic because the medication you have abused is no longer functioning as medication. It is now toxin in your body, building up acidity in your entire system. And when this happens, it will lead to rapid breathing, it will lead to shock, lead to low blood pressure. It also lead to heart problem if it is not well managed. Okay, so it is essential you endeavor to follow the prescribed medication by your healthcare provider. And then the eighth complication is hypoglycemia. Your liver helps to regulate your blood sugar level, and when the liver is impaired, your blood sugar level becomes unnecessarily low, becomes too low, and it will be difficult to manage. Most times it is difficult to manage low sugar level than the high sugar level. So when your liver that was supposed to be regulating your sugar level is impaired, it now leads to low sugar level, excessive sweating, weakness, fainting, seizures, and most times coma. Yes, if you see a patient that is having, or an individual with hypoglycemia, as in low sugar level, most times the person enters into coma with excessive sweating, cold clammy extremities, and it takes God intervention when it gets to that point. And also expert care is needed when it gets to that point. So it's essential you maintain the dosage prescribed by your health care provider. And then the ninth complication associated with it is permanent liver damage or liver cirrhosis. Okay, once you get to this point, the liver remains permanently damaged. So don't just commonize any medication. Follow the right prescription. Okay, and if you omit your medication, ensure you don't double the dose per time. Take the right dose that you're supposed to take, even if you skip it. Don't, because you have missed the timing when you're supposed to take the other medication as such, you want to meet up and you will want to combine both the previous one you missed and the present dosage, to combine it together. That is suicide. You're committing suicide. So please refrain from such attitude. And the 10th and not the least is death. Yes, paracetamol. Paracetamol, if abuse, can lead to death. That is, having done all to stand and all the organs refuse to stand, what else will be the end product? That is death. But that is not my prayer for you. You know, health is wealth. I'm rooting for you. I care so much about your health. I care so much about your health and your well-being. That is why this information is coming to you. So endeavor to treat this information as one vital health information. Share this video to enlighten others. You might not need it, but people around you, neighbors, colleagues, friends, family members, might be in need of this information. Hence, it is essential you share this video to enlighten them, or play this video for them to listen. It might not be now, but in the future you might see some other person. So be well informed. Listen to this video, watch this video to the end. Be well informed so that you can pass this message to others. Remember, health is wealth. If you must live wealthy, then you must stay healthy. And how do you stay healthy? By keeping to the recommended dosage of medication you are asked to take. Another routine that you know that is essential for your well-being. So please, health is wealth. Life is too precious to be wasted. And I know you don't want to waste your life. You don't want to waste your destiny. You don't want to waste your time here on earth. So this video is coming at the right time so that you refrain from doing such. I'm Nurse Bob D. Please endeavor to subscribe to my channel. I create content on health, fitness, and lifestyle. Endeavor to subscribe to my channel if today is your first day seeing my video, and also turn on the notification bell to stay informed whenever I upload a new video. Thank you so much for watching this video. endeavor to visit my channel to watch other videos on reasons why you shouldn't abuse paracetamol tablets and the reasons why we have so many liver challenges in our society today. Thank you so much for watching this video. Till I come your way again, stay safe, stay healthy. Bye.